Welcome to the Utah Built podcast, celebrating the people, personalities, businesses, and brands that are uniquely Utah built. Check us out wherever you get your podcasts, download your audio, follow us on social media, and check out the YouTube channel for all of our previous interviews with people like most recently Jeremy Andrus from Traeger, Dan Young from PC Laptops and Zydax, as well as many, many more, including Jim Olson from the Utah Jazz, John Kimball from Real Salt Lake, and all of our previous Utah Built episodes. I am Jared Banks alongside Kimball Kjar, our co-host.
Good to be back. Thanks for having me.
And president of the Utah Warriors. That is kind of the catalyst for our conversation today with the man, the myth, the legend, right? Rob Allen, president and CEO of Intermountain Health. Thank you for being here with us, Rob.
It's my pleasure to be here today. Thank you for the opportunity.
Excited to have you as part of the Utah Built family and everything that Intermountain Health is, not just as our partner with the Utah Warriors.
They are Utah Built.
They 100%
They're
Utah
the
Built.
definition of Utah Built, especially when it comes to healthcare.
So talk about who young Rob was. Tell us about, because you're practically a local kid, right? You grew up in Star Valley, Wyoming, one of the most beautiful places on God's green earth. Talk about what life was like for young Rob.
Yeah, so I'll even start Utah Built here as we talk about that. I was born in Bountiful, Utah.
Oh, were you?
Yeah,
Okay.
so my parents...
I knew you were good stock.
My parents who grew up in Star Valley, Wyoming, got married right out of high school, moved here to Utah. We lived in Layton. And I spent my early years in Layton before we moved back to the farm where I grew up, which is my mother's dairy farm where she grew up in Grover, Wyoming. So the young Rob Allen, I try and forget those stories. So I have to think deep and
well, we're highbrow in the boardroom now, right?
Determine what's appropriate to share, right, in these audiences. But I had a remarkable youth. The opportunity to grow up in the area that I did on a farm was just a great experience. It was hard work, twice a day milking cows, 7 days a week. You didn't get vacations. You just did what had to be done. But I had a lot of opportunity as well. So I love sports, loved to play sports, played basketball and football. That's what we had in Star Valley at the time. And it was really the activities for the community were around the school teams. So you always wanted to be a part of that, and you grew up looking for that and trying to make the teams. And that was a lot of fun. Did a lot of cowboy things, had horses, and did some rodeoing as well, and enjoyed those as sports and activities, and just the mountains, getting out, snowmobiling, motorcycling. Every time we had a chance not to be milking cows and hauling hay, then you tried to find something to do that was fun, just in the mountains and outdoors.
Work hard, play harder, right?
What was your favorite event in the rodeo?
So I was a bull rider.
Okay. Yeah, the man.
Yeah. I look back and I said some things were foolish, right? Whatever you talk about it. It's one of those fun stories that I rode my first bull when I was 12 years old. And in rodeo, for those of you who follow rodeo, you'll know this. For others, you may not. But cowboys put your name in a hat, and they draw the cowboy and they draw the bull. So it's by chance you get paired up. And when you ride, there are two judges, and the judge gives 25 points to the rider and 25 points to the bull, and so there's 100 points total given. So my dad, I had two older cousins that were quite a bit older than me who were bull riders. And when I was 12, my dad said, "Would you be interested in riding a bull?" I said, "Yeah, I'd love to do that. Let's give that a go." So they give me this book, written by Larry Mahan, a world champion bull rider. And so I read this thing. I don't know, it was 3 or 4. It wasn't very long, but I read it. And I went and bought me a bull rope, and we got an old cowbell that was rusty, and
what did it
we
say?
painted
Just
it
stay
up
on top of the bull
basically
for 8
stay
seconds.
on. Yeah, hold on tight. A few tips like follow the head. That's one of the main things in bull riding because, if you can stay with and follow the head, and the big cautionary note, don't go over and hit the head. I had one of those cousins of mine actually had his face smashed in because he hit the head of the bull coming back at him. It had a lot of surgery to repair that. But So we went up, and my dad helped me put my name in. And the rodeo organizers had a little bit of compassion on this kid, and they didn't draw the bull. They actually handpicked my first bull, which turned out to be a mistake because it was this old Angus bull that hopped around, and I rode him for the whole 8 seconds, right? So now I'm hooked. And I scored a big 51. That was my score. I got a 51 out of that. Those of you who go days of 47 know the scores are quite a bit higher than that for Cowboys.
Just between us, Rob, know that you and I have a combined score of 51 riding bulls. So that's 51 more than I have.
So this is, I grew up in a home where my mother was wise. I appreciated years later how wise she was. And she had a way of making you feel like you got to make all your choices. And yet now I look back, she was pretty smart in how she positioned it, so we made the choice that needed to be made. So I rode bulls for 3 years. And it was just the summer rodeos. I didn't travel, so there was only 2 or 3 a year in Star Valley. And at the end of that third season, I was going to be a freshman in high school. So I rode in August. She let the dust settle for about a week. And then she pulled me in and sat me down and she said, okay, you've got a decision to make because I can't take this anymore. I'm a nurse. My mother was a nurse at the local hospital. And she said, all summer long, I have to put cowboys back together in the ER. And then all fall long, I have to put football players back together in the ER. So you got to choose one. I can't do both. Which one are you going to choose, right? Well, of course, I get to wait a whole year to ride another bull, or I get to play football with all my buddies next week. What are you going to choose? Well, I chose football. But in the process came not just the choice, but the promise to my mother that I was choosing the one over the other. So that ended my rodeo cowboy days. And as I look back, that was probably smart that those ended there. And my mom, she was pretty wise.
Yeah. Well, speaking of your mom, she was in the healthcare industry, obviously. Tell us a little bit about how that may have weighed into your occupational, choices.
Yeah. So I grew up in a home on a farm, as we've noted, but when my parents were here in Utah before we moved back to the farm, my mom went to Weber State and got an associate's degree in nursing. And she was an ICU nurse at McCady Hospital. So she had pretty intense experience before we went back to this small community where she became a nurse at that local hospital, a little 15-bed hospital in Afton, Wyoming. And our farm was 6 miles north on the highway in Afton. And if you know the valley, there's one highway that runs the distance of this 40-mile-long valley of Star Valley. And so whenever an ambulance would go down the highway, my mom would go from wherever we were. We could be in the barn milking cows, out in the fields hauling hay, and she immediately went to the house to call the hospital. And the reason she did that is at any given time, there were only 2 nurses on at this hospital. They covered everything. And the doctor lived on his cattle ranch 30 miles from the hospital. So, when a crisis happened, they had to call the doctor, and it took time to get there. And we lived, within 10 minutes of the hospital if she hopped in her car and went, down the highway fast. And she would always call, did they need help? And I got to watch that in action. So that was in the back of my mind. And when I went to college, and by the way, again, back to my mother, great influence for me, she and my father decided that I needed to go to college. And I became the first member of my family to get a bachelor's degree at college. And when I graduated from high school, my mother gave me a set of luggage. And to make sure that I didn't misunderstand, she said, now you know why you're getting these. And I said, why am I getting these? And she said, because when you graduate, you're going to pack your things and you're leaving. And they wanted me to go off on my new grand adventure and, go off and find college and build a career and do all of those things, which I'm grateful that they pushed me on that. So when I went to college, and then I served a mission in Japan and came back and went to BYU. And at the beginning part of my junior year, I suddenly realized that getting a college degree actually didn't guarantee you a job, right? I mean, I didn't know anything about college because I didn't have family who'd been through that whole experience, getting a bachelor's degree. And I had this realization, then started thinking, well, what am I going to do when I finish with this bachelor's degree? And my mother's example came back to my mind. And I thought, that's a really interesting place to spend your energy and time. Healthcare provides value and benefit to the community at large, and I want to do something with my business degree that brings value to the community where I live. So that was kind of the impetus that started. It was the thought about her and then this concept. And you don't want me to be your doctor or your nurse, so the business side is the best place for me to be. And I then started to pursue that thought and journey as I completed my undergraduate degree in operations management at BYU and looked for opportunities in healthcare. And that's really what got me started down this road.
So it wasn't like you were sitting at career day and you thought as a little 17-year-old Rob, I'm going to manage a hospital. Like that. I don't think that's an option for anybody at 7. You want to be fireman, policeman, you want to be a professional baseball player.
Correct.
So that didn't come until later. So now as a young executive, you get to basically travel the country and you've been in charge of hospitals from coast to coast. Talk about what that's like as a young executive, because it's not something, there's not many people that do that job, right? It's not like it's this, there's a lot of investment bankers, there's a lot of, finance people, there's a lot of, these other jobs where you don't come across hospital administrators very often. What was that experience like?
Well, there's multiple ways to become a hospital administrator. And for me, I took a less traveled path, I would say. A lot of the folks today they come up through master's programs, they come through fellowships. We have several fellows this year we're just bringing on board after they've completed their master's degrees, and they'll work for us for the next year, and chances are they'll work for us after that as well. And there was this process of how you get into it. Well, for me, when I completed my undergraduate work, or when I was completing it, I had a chance to meet with Dave Jepson, who was the Chief Operating Officer at Intermountain Health. And he was so gracious. It took me 3 months to get on his calendar, but he gave me an hour of his time. And we sat here on this floor, just close to where we're sitting right now, many, many years ago. And I had a chance to explore with him healthcare administration. And he said, well, Rob, you're young. You need to go get a master's degree somewhere, right? And he recommended several schools and gave me some advice. And I went home and looked up these schools. And here I am, a young married. We had a son that was about a year old. I had student debt already, and I looked at the price of these master's programs, and I thought, well, the last thing I need is more student debt and more years of schooling. I need a job to take care of my family. So I went a different route, and I had an opportunity to get into long-term care out in Colorado, nursing homes, and become an administrator there. And so that gave me a first flavor of how you get in and lead an organization. And that was supposed to be a 12 to 18-month training program. Well, in Colorado, I had the chance to sit for my licensing boards, which in nursing homes you have to be licensed. That's not true of hospitals. Hospitals typically require more education, and that's kind of the change off. But I sat for the boards. I was licensed. So what was supposed to be this 12 to 18-month training, in 60 days, I was running my own nursing home. I'd become the administrator. And knew nothing, of course, and I was trying to feel my way along. And it was a good learning experience. They weren't large operations. And a year and a half into that, I got a phone call from somebody I had networked with who was in Evanston, Wyoming, and he said, I'm going to be hiring a CFO. Would you be interested? I said, absolutely. And so at 25 years old, I was hired as the chief financial officer at the small hospital in Evanston, Wyoming. On the job learning, and I was learning my way along and went to school at nights at Utah State, got my MBA, and 3 years later was named the administrator. So at 28, I took on my first CEO job at a small hospital, and it was all about learning on the job as you went, with this passion and desire to serve well. But fortunately, a small enough operation, I could learn along the way. So it was kind of a circuitous route compared to what normal pathways are for people into healthcare administration, but that's where it built, and it grew from there. Number of years later, Intermountain sold that hospital. It was an Intermountain hospital, so that's when I first got aligned with Intermountain. Intermountain sold it, and I stayed with my team and with the new owners and had a lot of fun for a couple of years, learning some new things under different ownership, and then that company took me to New Jersey. And one of the things in healthcare that happens, the average tenure of a hospital CEO is about 4 years. It's not long.
very long.
It's not long, and I often tell folks you're moving up or you're moving out. Now, fortunately, in the West...
What's the reason for that, if you don't mind me asking?
Two things that happen. So hospital administration can be very political. You think of all your constituencies, and you've got a board that you're accountable to. You've got a community who's using your services. You've got a group of doctors on your medical staff who are connected to you, may have different opinions about that. You've got your staff as well as you're going. And then there's just the financial realities of healthcare, and can you make it work? And in all of that, there is risk that it builds and may not be a fit over numbers of years. The other thing that's a bigger reality is that in healthcare, the journey for leaders often is developing. So you have an opportunity after you've been in a role for a number of years to go on to other roles. And either it's moving into the CEO jobs or it's moving up into larger hospitals. And so there's this career journey that often changes for folks. Now, the tenure in Utah and the surrounding area is actually longer, interestingly, in healthcare. The average tenure here is double what it is the rest of the country, which is a nice feature. But nonetheless, there's this motion that happens. And so I had the chance to go to New Jersey, bring a hospital out of bankruptcy, do a major turnaround there, which I really enjoyed. Went up to Massachusetts, led a hospital for a short time, and then Intermountain called and said, hey, you want to come back? And we jumped at the chance to come back to Utah.
So do you think your experience with that hands-on learning, obviously unique in this situation where most people come through the education side, sets you up because you were already on the job and doing it while other people were still sitting in the classroom? Do you think that had a big effect? Because I think we're seeing that a lot now kind of in the education place where experience counts as much as a degree hanging on the wall.
You know, for a lot of years, Banksy, I worried that I didn't have the broad perspective because I hadn't done that traditional route, right? After I'd been at Evanston for a lot of years, and I was there with Intermountain for 11, 3 as the CFO, 8 as the CEO, and then the hospital was sold and I stayed another couple of years after that before I went back east. Someone once asked me, why did you stay so long? Thinking of these tenures of leaders, right? And if I'd have been smart enough to think about career, and I'm just a farm boy from Wyoming, just keep that in the back of your mind, right? I wasn't smart enough to plan all this out, but for a lot of reasons, it felt right to be there and have this experience at the one location. But what I recognized at that point in time was being at the same hospital for 14 years taught me a lot more than I would have learned in any educational program, or frankly, jumping jobs every 3 years in healthcare administration. Because what I learned was to live with my decisions. I got to see the long-term impact of everything I did. And every one of those that turned out to be wrong, I got to clean up the mess. So, that's a really good lesson on how to do it better the next time along the way. And that became a critical part of my development. And I'm grateful for that opportunity to learn hands-on in such a way over a long period of time and see better what truly matters and what truly impacts those we're trying to serve versus what might be a flash in the pan and then has to be cleaned up later.
Or what makes sense on a spreadsheet as far as, the body in the bed that needs the care, right?
And that's probably the thing that I'm really interested in. I'm a son of a doctor, right? And so obviously in your situation, having been the son of a nurse, and you probably saw the other side of, because I think often, when we look at the healthcare systems that we all are dealing with, whether we're, the end user or we're part of the, those organizations like you are, you're looking at the behind the scenes operation, the force that is often unseen that makes the whole healthcare system possible. But sometimes I think, I'd love to get your thoughts on what that looks like from a healthcare administrator, particularly in your position in Intermountain Healthcare, Intermountain Health, how you guys look at things differently, and maybe what your experience of having seen and witnessed. I don't know how many times, sorry, there's a bit of a narrative question here, but I don't know how many times I was down at my dad's office. He was a surgeon, and I was sort of his de facto medical assistant, handing him this or handing him that, and, helping a little kid that maybe just needed to get some stitches or something. And you see just how important, the well-being of the patient is. I thought for a little while there that maybe I'd go into medicine myself. That was obviously the wrong idea.
Thankfully, that didn't work out.
But, I'd love to get your thoughts on that kind of dichotomy that there is the business side of it, but you got to have the business in order to make sure that you can actually serve the patients and the families and everyone else is in the system.
No, it's a really interesting question, and something that in my journey I learned some perspectives on, that partly through my mother as I watched that, just like you did with your father. But as I got into the business here, one thing that became apparent fairly quick was that there's a natural tension between doctors and administrators. If you just take those two as examples with it, and when
I can verify that from my many conversations with my dad. Trust me, yeah.
And yet, ironically, it's only a very small amount of the work we do that actually has friction points to it. When you stop and really think about where we're going and what we're trying to accomplish. And what I learned was that 90% of what we do is already aligned. We spend way too much time in the 10% managing or dealing in or delving into the frictions when we should spend our time on the 90% saying, how do we figure out how to do this better for those we're serving? And frankly, if you spend your time there, most of the other 10% goes away. We figure our way through that, and it was really helpful for me to actually have some perspective when I started, to think that through very carefully. And by the way, I'll come back to that in just a second. Don't let me forget to come back.
I took us off a tangent. You're
great.
Welcome to do your own.
It's great. And when I think of Intermountain's history, so I'll bring my personal experience to Intermountain. Intermountain was formed in 1975. Our hospitals go back to the early 1900s. Primary Children's just celebrated last year its 100 years. But Intermountain as a corporation was formed in 1975 when the Church of Jesus Christ of Latter-day Saints gifted its 15 hospitals to the community. It formed a board, created a not-for-profit, and gave those hospitals so the communities could continue to be served, with the charge to be a model health system. And in that process, there is this foundation that was established around the purpose of why we're here. And our board and our leaders and our caregivers have, for the last nearly 50 years now, focused on delivering for those that we're here to serve. And that brings us back to that point. Now, let me go back to right after I was named administrator at Evanston Hospital. I'm 28 years old, wet behind the ears, don't have a clue what I'm doing. I got the job. There were only 2 people who applied, so that's always helpful, right? And I always tell people who want to get into healthcare, what's a good way to get into healthcare? I said, go places nobody else wants to go. And then at least you got a better shot at it, right? And then once you've had your first job and got experience, then you can go play with the big boys and the big girls in the settings that you really want in the long term. But it's these places where people are looking for talent, not just looking for long resumes, where you can get a chance. And I got that chance. And then I learned, where I'd been the CFO for 3 years, that one of the doctors wrote a letter to Intermountain recommending me for the job. That doctor's name was Steve French. And Dr. Steve French was the leader of the ER in Evanston. He, by the way, he and his wife Marilyn, at the time, had done about 70% of all the research on grizzly bears. And Steve was a little bit crazy. So he'd go up in Yellowstone, crawl in the dens with the bears. He'd tag them in the winter, he'd go up and play with them in the summer. He'd bring pictures and videos, which were cool to watch, but he was a little bit crazy on the one side.
Was he his own client, though? I guess that's the question.
To my knowledge, Steve and Marilyn never had incident with bears.
Wow.
As far as an attack or anything that was negative for them. They used to do amazing research on them, and so he's really a fascinating guy. But he came into my office. So I've been named the administrator. I'm now moved in the administrator's office. It's the first week. He comes to see me. And he sits down with me, and we chat. And I had just found out he'd written this letter. I didn't know until after I was hired. And so, of course, I profusely thanked him for doing that. And we chatted for a bit. And then finally he said, Rob, I've been doing this leadership in healthcare for 21 years. He'd been running ERs and practices. And he said, I've learned a few things. Do you mind if I share a couple things with you? And I said, please, Steve, anything you can give me, please help me out here. And he said, well, first, when I look back at my career, he said, whenever I've gotten in trouble, I breached one of these 2 rules that I have set out for myself. And interestingly, I've been in healthcare a long time, and I can now say, whenever I've gotten in trouble, I breached one of the 2 rules Steve told me about many years ago. But he said, the first thing is always make your decision based on what's best for the patient, right? And that seems so natural, so intuitive, and yet it was really important for a young administrator like me, thinking, Kimball, about the friction point we just talked about, to be grounded in this reality that our first priority and obligation is to make the decision based on best for the patient. And that helped me from day one, not get lost in the spreadsheets and the other things, and make sure I was grounded. And that quickly turned into this understanding of doctors and administrators are actually trying to accomplish the same thing. We have different issues we're dealing with at the moment, and we're trying to figure out how to bring them together. And if we can quit getting mired in the quicksand of the 10%, we can actually focus on doing what's right for the patient and figure out how to get where we need to go together. And I've had great friendships and great partnerships with my physician colleagues over the years because we focus our discussions on what we're trying to do together. So after we talked for a while, I said, well, Steve, what's the second item? And he said, the second item is never make your reaction to an issue bigger than the issue itself. And now, I think that's wise counsel. And now I look back and I can say, yeah, when I've gotten in trouble, I think I've forgotten one of those 2 things. And it brings me back to ground and get anchored on the things that are important. And I think Intermountain's history of focus on mission, tied to those points that I've learned along the way, have allowed us to navigate in a very focused way to assure we're doing the right things for those who count on us, who we're here to serve.
So talk about mentors and positive influences. Let's go back even farther than your early career. What's something that you learned from your mom, obviously with the compassionate side of the service, and your dad? What's something you learned on the farm from your family that has carried over into your career that's been constant and consistent?
Well, being on a dairy farm, you learn how to work hard and you learn how to do it every day. And healthcare is a consistent thing. It needs to be consistent in our ability to work through challenges. And that's been helpful for sure. Watching my mother, one of the things that really sunk deep in me when I was thinking about career was her example of compassion and care. That it was so important to make sure people were taken care of that she would drop whatever she was doing. The other side of that I learned very quickly too in my youth years when I started to see her interact with her nursing colleagues was the sense of team. Part of her response was for the patient. If there was a car crash on the highway and you had 4 or 5 patients in that car and you had 2 nurses at the hospital, they needed help, so the patient was taken care of. But they also needed teammates to come for them to function together for those they were serving. And there was this team side of it that I started to see that was fascinating and remarkable from the standpoint of how we go about doing the work we do. This is not a one-man band show, right? This takes everybody coming together and from that team building strength, learning from each other, helping each other, and everybody succeeds better with that. And those were some lessons that I learned early on that kind of carry over in everything that I do or try to do in my leadership roles in healthcare.
So compassion, teamwork, hard work, and then focus on the care and never make your problems Never make your responses larger than the issues, right?
Yep.
Those are 5 key core things, and I guess you could really apply those to any business.
Well, you could also apply the fact that the principle, some of you probably learned up on the farm, that you're probably going to step in the metaphorical. You're going to have to post-produce this here, Mason. The metaphorical
manure.
shit.
You're going to step in the manure.
And you're gonna have those moments, right? You're gonna have those situations where it's just gonna happen, and you're not gonna be able to. But in that vein, I'd love to get your thoughts as well on, Intermountain, COVID, healthcare systems, and the trajectory that we're now seeing with healthcare systems since COVID. Obviously, Intermountain's gone through a significant rebrand. How do you see Intermountain being able to continue that development, that change, that evolution of the next phase of its growth? What does the next 10 years look like for Intermountain?
Yeah, I think healthcare is exciting, and I'll start with this, and then I'll go into some details. But when I got into healthcare, I had a mentor who helped me along, hired me to that first job. He was the administrator, right? I replaced him when he went on to another job, and we've stayed connected through my whole career. But he made some comments early on that just left me wondering. And he said, Rob, why do you want to get into healthcare? When I started in healthcare, it was fun. It's not fun anymore. It's complicated. There's so many more regulations. It's challenging. It's just not fun like the way it was. And I used to think, I think it looks amazing. I'm excited to be in healthcare. And I used to respond to him and tell him all this as well. And he'd just look at me, like, yeah, you'll learn or whatever. And it's kind of fascinating now in healthcare. I've been here a long time in healthcare. And I look at my colleagues across the country, and I'm hearing some of the same rhetoric. It used to be fun. I don't know why you'd get in healthcare today. And I marvel at the comments, because my biggest regret sitting here today is I don't have another 25 years in healthcare. We are sitting at a time where we can do more in the future than we've ever dreamed of to serve well, use technology and capabilities, enhance lives in a way we didn't think about when I started in healthcare. Some of it was evolving, but we are at this unique place. COVID taught us a number of things. First off, I was thrilled when our caregivers were heralded as heroes. They do remarkable things day in and day out, and we watch them through this process deal with the challenge of COVID. And just think of this, because all the listeners out there and you guys, you lived it from your own perspective. There was stress, there was challenge, there was worry, there was wonder. There were so many things hitting every individual and family that had to be dealt with. Every one of our doctors and nurses and caregivers had all of that at home. And we're coming to work when we didn't know what the disease was. We didn't know how contagious it was. We didn't know what the risks were in depth. And they showed up every day with all that unknown, putting on whatever they thought they needed and whatever thing we could get garnered from our experts of what they needed to stay safe, and walking in those rooms to take care of patients.
Yeah, literal ground zero.
I had a doctor, the first time it really hit me of the broader issue outside of the hospitals and clinics, was a doctor who shared their experience, a young family who was working in the hospital and had quarantined himself in the basement of his home to keep his family safe. And having to listen through the visqueen between the stair doors from the basement to the upstairs, his 5-year-old child's birthday party that he couldn't participate in. And he was separating to make sure he didn't bring risk to his family. And I thought that sums up what our caregivers have gone through. And all the stress of the world around them, this is added not just at work, but a new dimension at home as well. And yet they show up every day. And then we went through this process, unfortunately, where within months, 6-8 months, then our caregivers are getting spit on and punched and bitten if they'd ask somebody, about COVID symptoms, because certain people would get upset if you talked about COVID. And it was really sad to see that quick flow there. That's settled, fortunately, now, and we're moving on. But in the midst of all that, one of the things we learned at Intermountain's a relatively large organization. We have 64,000 caregivers. We're the largest private employer in the state of Utah. And in all of that, with our caregivers, as we move the needle on things, as we try and move things forward, we try and be methodical about that. We try and be cautious and move at a good pace. But as a larger organization, sometimes that pace isn't as fast as we'd like it to be. In COVID, we learned we can move really fast. We stood up testing centers in days. We changed processes in a matter of hours sometimes every time we'd get new information in order to assure we were current, taking care of the community. And so we learned we had a speed within us that we frankly didn't know before. That's really important as we look to the future because it's so dynamic. We're going to have to continue to change and be very nimble. We also in the process learned that we could give care in a lot of different ways. We moved patients to home and did hospital level care at the home with home care nurses coming in, remote telehealth with doctors monitoring them constantly. And as we think about the future of care, most people want to be at home. I mean, I love our hospitals, and I think they're beautiful, and I think our caregivers do a beautiful job of taking care of you. But the fact is, I don't hear anybody in our hospital saying, can I stay a few more days? Because this is just great, right? They want to go home where it's their space. They want to go home where they're closer to family even. And people heal faster that way. And in the future of healthcare, we're going to see technology advance that allows us to use the technology to simplify, make the jobs more simple for our caregivers. It's too complex today. It's projected that 25% of our $4.4 trillion spent in healthcare in this country is spent on administrative process that arguably isn't necessary.
The red tape.
I'll give you an example, by the way. In the 60s, when the social programs were launched and Medicare became something and the government got involved in funding for healthcare, we were being paid based upon what your costs to provide care were. In 1982, and to get that, you had to put down what it costs for a pill, right? You've seen the bills with the aspirin and all that and the debate of what's the processing cost and all that. That had to be there in order to get your payment. In 1982, the government went to a process they called DRGs, Diagnostic Related Groups, where they said, we're going to pay you a flat amount. We don't care what it costs you to provide the care anymore. 1982, just think of the time frame. Today, we still provide those detailed bills to the government because they require us to provide it. And yet it has nothing to do with what we get paid. We get paid based on what your diagnosis is. And they don't care what it costs.
Meanwhile, the processes, the methodologies, the treatments have all changed. I mean, you're talking about the transition of healthcare going from the doctor's office to the local doctor down on the street corner to the hospital. And now we're seeing the transition, like you said, back to the healthcare being provided in the home. That's got to be a fascinating shift when you talk about the costs involved.
It is. And how much of that administrative cost can you cut out, right? The other thing that's really intriguing when we talk about simplifying and understanding what people need and being there as their partner in health and healing when they need us, 27% of that $4.4 trillion was spent on providing care that was preventable or for something that was preventable. And so how do we get upstream and actually help people stay healthy where they want to and be that partner along the way? And so I think we have these huge opportunities ahead to make it easier to get the care we need, to actually be there when you need us, upstream to keep you healthy versus just when you have a crisis in medicine. And I'm just excited for the future. And I think Intermountain is well positioned to help this transition here in Utah, across the Intermountain West, where we have other facilities, and even nationally partnering with other systems along the way.
Well, I'm sure from my perspective, you see all the things going on in the news and the bureaucracy and the machine that is big pharmacies and healthcare, right? How refreshing it is to hear an administrator at the highest level say, let's get people well on their own so they don't need us. No one in medical healthcare is saying that, at least not from a press and PR standpoint. So refreshing to say over a quarter of those things are preventable instances. Let's give people the power to be able to deal with that on their own so they don't need us.
Here's a perspective, Banksy, that I think is remarkable. We spend our time as organizations doing lots of functions. You think of any business who's trying to position themselves competitively against other similar organizations providing similar services. I've watched healthcare do that my entire career. Organizations competitively try and position. Why are we doing that? I mean, just stop and think, what is our real competition in healthcare? Our real competition is disease. So how do we actually start pulling organizations together to actually solve and compete against the disease, which is the real thing we're here for? Mm-hmm. Unlike many other businesses, right? It's different than others, but that's our mission. That's our purpose. And so we should be looking not just ourselves to do it, but how do we partner with others to do it? And I think there's huge opportunities in the healthcare world for organizations to come together under that common purpose and do more good together than any of us could do individually.
It's a great perspective. Thank you.
It's amazing. I'd love to looking back on your time now with Intermountain, but also in your previous stints. What's one thing that you wish you had known, and then what's one thing you're glad you didn't know over the course of your career?
No, that's a great question. What's one thing that I wished I would have known, and one thing that I wished I wouldn't, or I'm glad I didn't know? The second one comes to mind.
I think everybody that's been in
I'll come
business,
back to that one. But
I think everyone that's been in business is always glad looking back on. Like, I'll tell you right now, I'm glad that I didn't know how hard it was going to be to start a professional sports team. Like, probably one of the hardest things I've ever done in my entire life. But everyone has something, I think, in their career that they know that naivete is actually kind of a good thing in some ways. Yeah. But what are some of those things that you wish you'd known?
I would say the first being, I wish I understood better the power or the opportunity a leader has to truly influence and impact. And I've learned over the years, watching other leaders, frankly, that there is more opportunity there than I understood out of the gate. And when I started, I was very much focused on what's the job, do the job. You got to get your people together in order to get the job done. Sports teams, you look at that, you rally people. I mean, all of those things are there. But the role of a leader is so important and has such an impact on how people experience their journey and how much they're able to succeed in their journey as well. I've seen leaders do amazing things. I've seen leadership actually cause barriers that really block people from doing what they're actually there to do. And that's a shame when you see those things. And as a young leader, I wish I would have understood the opportunity better for impact. I would have been a better leader in those days along the way if I had. Now, the thing that I'm glad I didn't know along the journey, as I look at healthcare and where things are, I'm glad I did not understand just how little I knew in the scheme of the world, right? I mean, I came out of rural Wyoming off this dairy farm, successful athletic teams I played on where you just felt like, hey, what needs to be done can be done. That's it. You go figure it out and you go. So I had this attitude that, I don't know everything, but we'll figure it out. I can go. Looking back now, had I had a perspective of how much I didn't know, I think I'd have been too scared to actually take the journey because there was so much that needed to be learned along the way, and I think it would have just felt overwhelming. And yet I had this desire and this idea that we can figure it out. Let's go do it.
Well, I think that's probably the amazing thing that I'm hearing from your story is that sometimes I think people in their lives, time and age makes cynics of us all, right? It tends to give us reasons to tend to say, no, this can't be done. But like you just said with what you guys went through in COVID, you guys found a reason. Intermountain found a reason to say yes, to find solutions where there were no solutions, and you just had to figure it out. And that's really, looking at your story, what I'm seeing is that when you're on the farm, you just got to figure out a way to get the job done. It doesn't matter. The job's got to get done. And that's what I'm looking at your story in the Intermountain, ecosystem. That's what you guys are doing.
Well, we have amazing people. So, I have the privilege of leading this amazing organization, but it's our people who do all the amazing work. So I just get to cheer them on. But it really comes back to, and I alluded to, I didn't quote it quite this way, but there was a saying we had in rural Wyoming where I grew up, and that was, what must be done can be done. And it's this attitude that if it must be done, there's a way to figure it out. And I think as we look to the future of healthcare, what must be done can be done. And we know it has to change. It's got to get better. It's got to impact in different ways. It can be done. We just have to figure out how we get it done.
What a beautiful and simple statement, right? What must be done can be done.
Yeah.
There's a way to do it all. We just have to get out of our own way sometimes to do it, right? So one final question here as we get down the stretch. As a young boy here in Utah, now coming back home and, sitting here as we stare down at the Capitol building just to our north here, what does it mean to you to be uniquely Utah built?
I love the term, by the way. When you reached out and we saw this term, I said, I like that term. This is really, I think, important. Utah built. And for Intermountain, I'll talk about Intermountain first, and then I'll talk about me. Intermountain clearly is Utah built. It was the early settlers who decided there was a need. Primary Children started because some Relief Society sisters saw a child struggling down the street and said, we need to do something to help children that have needs. And that's how Primary Children started. Now it's a premier children's hospital here in the country, serving a broad area of the United States here in the western U.S. It's a great thing. And all the roots are here, the purpose is here, and we intend to carry forward that great legacy as we build in the future. And Intermountain is Utah built. No clear. And I should be clear, there were some hospitals in Utah and Idaho in that early group as well that were given. But it's always been based here in Salt Lake City, and we're proud of that fact. And it's helped us. It's helped us become who we are. It's helped us get better. Personally, for me, Utah built. I was born in Utah. As we've noted, I was raised in Wyoming. I did my education here in Utah. A lot of my career has been with Intermountain, based here in Utah. Well, hospital in Evanston. Some people think that's part of Utah. It's so close, but
it's far eastern Utah.
Evanston County.
I've spent a lot of my life in Utah.
I've seen how many Utah license plates are out there.
Yeah, especially around July 4th.
Especially around $1.5 billion lottery jackpots.
Absolutely.
That too.
Absolutely. And so, you look at what does it mean to be built? And that's part of what I love about your statement and your phrase. Built is, in my mind, coming together to create something more. And here in Utah, I think that's our ethos. We bring together expertise to build something more. And as we do that, I've become a better person. I've become a better leader. Intermountain's become a better organization over time as we continue to learn. And we also, I think, help each other. So as we're helped, I think in the process we help others. And it's that coming together that frankly is not only important, but I think somewhat unique to our culture here in how business is done. And it's fascinating when you think about COVID and the pandemic. Utah got it right. The balance between caution and the balance to support and keep business going, I think Utah did it better than anywhere in the country. It was hard. I'm sure if we had to do it again, which I hope we never do, we would do it even better. But there's this concept of how we pull together to help each other, how we make sure the community's taken care of. And that played out in COVID, even in our business community. And just proud of the state, proud of the leaders here, proud to be a part of it, and just simply say, I wouldn't be here if it wasn't for so many along the way who helped me. And I hope in my journey I'm helping others as well.
From our households, communities, churches, organizations, businesses, brands, people, and personalities that are uniquely Utah built. I'm going to stop talking before I ruin anything that Rob just said, because that is the perfect note to go out on. Amazing. So thank you so much for your time and for being here with us, for carving out a little piece of your busy schedule, Rob. We very much appreciate it.
It's been my pleasure. Thank you for the opportunity.
Make sure you download all of the audio wherever you get your podcasts. Follow us on social media and check out everything Utah Built has to offer. On behalf of the president and CEO of Intermountain Health, Rob Allen, Kimball Kjar, our production staff, and Mason Benson, I'm Jared Banks. Thank you, and we'll check you out next time on Utah Built.